How to read your blood sugar results like a doctor. Have you ever looked at a blood sugar test result and wondered, is this normal or should I be concerned? Maybe you see a number like 95, 120, or 200, but you're not sure what it actually means. Here's something important. Doctors don't interpret blood sugar by looking at one number in isolation. They consider when the test was taken, whether you are fasting, your symptoms, your medical history, your medications, and most importantly, the pattern over time. In this video, we'll show you how to understand the most important blood sugar results, including fasting blood glucose, random blood glucose, and hemoglobin A1c, commonly called HbA1c. By the end, you'll understand what these numbers mean, which ranges are generally considered normal or abnormal, and when a result deserves medical attention. Let's start with the basics. What exactly is blood glucose? Blood glucose is simply the amount of glucose, or sugar, circulating in your blood. Glucose is one of your body's main sources of energy. Your brain needs glucose. Your muscles use glucose, and many other cells throughout your body depend on it for energy. After you eat carbohydrates, they are broken down into glucose. The glucose enters your bloodstream, and your pancreas releases a hormone called insulin. Insulin helps glucose move from your bloodstream into your cells, where it can be used for energy or stored for later. Think of insulin like a key. It helps open the way for glucose to move from your bloodstream into your cells. In diabetes, this system doesn't work properly. Your body may not produce enough insulin, your cells may not respond effectively to insulin, or both. As a result, glucose can remain elevated in the bloodstream. And that's why understanding your blood glucose results is so important. Fasting blood glucose, your first key number. Let's begin with one of the most common tests, fasting plasma glucose. Fasting means that you have not eaten or consumed calories for at least 8 hours before the test. For most people, this test is performed in the morning before breakfast. Why does fasting matter? Because eating changes your blood glucose. If you eat a meal shortly before your test, your glucose level may naturally be higher. Fasting gives doctors a standardized way to look at your blood glucose when food is no longer having an immediate effect. In adults who are not pregnant, a fasting blood glucose below 100 milligrams per deciliter is generally considered normal. A fasting glucose from 100 to 125 milligrams per deciliter falls within the range used to identify prediabetes. A fasting glucose of 126 milligrams per deciliter or higher is in the diabetes range. But there's an important point here. One abnormal result usually does not establish a diagnosis by itself. In the absence of clear symptoms of high blood sugar, diabetes is generally confirmed with repeat testing or another diagnostic test. So, if you see one fasting glucose result of 130, don't immediately conclude that you have diabetes. The result needs to be interpreted in context. Random blood glucose, when timing matters. Now let's move to random blood glucose. And like a fasting test, a random blood glucose test can be taken at any time. You may have eaten recently, or you may not have eaten for several hours. Because of this, the number can vary considerably. Imagine checking your glucose shortly after a meal. Your result may be higher than it would be first thing in the morning after fasting. That's one reason the timing of the test matters so much. A random glucose result of 200 milligrams per deciliter or higher can support a diagnosis of diabetes when it occurs together with classic symptoms of high blood sugar. These symptoms can include excessive thirst, frequent urination, and unexplained weight loss. Again, context matters. For example, your blood glucose may temporarily rise after eating. Illness and stress can also affect blood glucose, so a single high reading should not automatically be interpreted as a diagnosis. Doctors look at the complete clinical picture and, when necessary, confirm the result with appropriate testing. Hemoglobin A1c, your long-term blood sugar picture. Now that we understand individual glucose measurements, Let's look at one of the most useful tests for understanding long-term blood sugar control, It's called hemoglobin A1C, or HbA1c. You may also hear it called glycated hemoglobin. Unlike a single glucose measurement, HbA1c gives us an estimate of your average blood glucose exposure over approximately the previous 2 to 3 months. It works because glucose attaches to hemoglobin inside red blood cells. The higher your average blood glucose, the greater the percentage of hemoglobin that becomes glycated. Think of HbA1c as a longer-term snapshot. A fasting glucose tells you what is happening at one particular moment. HbA1c gives you a broader picture of what your blood glucose has been doing over time. For adults who are not pregnant, an HbA1c below 5.7% is generally considered normal. A result from 5.7% to 6.4% is in the prediabetes range. An HbA1c of 6.5% or higher is in the diabetes range. As with fasting glucose, diagnosis generally requires confirmation unless there are clear clinical circumstances that establish high blood sugar. One reason HbA1c is so useful is that it doesn't depend on what you ate this morning. It gives us a much broader picture of your blood sugar control. Why HbA1c doesn't tell the whole story, but here's something important. HbA1c is an average, and averages can hide important information. Imagine the people who both have an HbA1c of 7%. One person might have relatively stable glucose levels throughout the day. The other might have large spikes after meals and episodes of low blood sugar. Their average could be similar, even though their glucose patterns are very different. That's why doctors may also look at fasting glucose, after-meal glucose, home glucose measurements, or continuous glucose monitoring data. Continuous glucose monitoring, or CGM, is a system that tracks glucose levels throughout the day. It can provide information about patterns that a single blood test cannot show. The goal isn't simply to chase one number. The goal is to understand the overall glucose pattern and manage it safely. When your blood sugar result is high now, suppose you receive a blood glucose result that is higher than expected. What should you do? First, don't panic. Instead, ask a few important questions. Was this a fasting test or a random test? Had you recently eaten? Were you sick or under unusual stress? Are you taking medications that can raise blood glucose? And how does this result compare with your previous results? These questions are important because blood glucose can change for many reasons. Illness can temporarily raise blood glucose. Stress hormones can affect glucose levels. Certain medications can also increase blood glucose. And of course, what and when you eat can influence the result. That's why the trend is often more informative than a single isolated value. If your fasting glucose is repeatedly elevated, or your HbA1c is increasing over time, that's a reason to discuss the results with a healthcare professional. Low blood sugar, when the number goes too far down, but blood sugar problems don't always mean that the number is too high. Sometimes the opposite problem occurs. Let's talk about low blood sugar, or hypoglycemia. For many people with diabetes, a blood glucose level below 70 milligrams per deciliter is considered low. Symptoms can include shakiness, sweating, hunger, dizziness, weakness, irritability, difficulty concentrating, or a fast heartbeat. You may feel suddenly weak or unusually anxious. These symptoms can be a warning that your blood glucose is dropping to low. More severe hypoglycemia can cause confusion, seizures, loss of consciousness, and can become life-threatening. This is particularly important for people using insulin or certain glucose-lowering medications. If you experience symptoms of low blood glucose, follow the hypoglycemia treatment plan provided by your healthcare professional. Severe symptoms or loss of consciousness require urgent medical attention. While the same number can mean different things, now here's another principle doctors use when interpreting blood glucose. The same number can mean different things depending on the situation. A fasting glucose of 130 is different from a glucose of 130 2 hours after a meal. A glucose of 200 may be concerning in one situation, but it still needs to be interpreted alongside the timing of the test, symptoms, and the person's medical history. That's why you should always ask, when was the test taken? Was I fasting? What medications am I taking? Was I sick? And how does this result compare with my previous results? These questions transform a number into useful clinical information. The numbers you should remember, so let's put the most important numbers together. For fasting blood glucose in a non-pregnant adult, below 100 milligrams per deciliter is generally considered normal. 100 to 125 is the prediabetes range. 126 or higher is in the diabetes range and generally requires confirmation. For HbA1c, below 5.7% is generally considered normal. 5.7 to 6.4% is the prediabetes range. 6.5% or higher is in the diabetes range and generally requires confirmation for diagnosis. For random blood glucose, 200 milligrams per deciliter or higher can indicate diabetes when accompanied by classic symptoms of high blood sugar. And for people with diabetes, a glucose level below 70 milligrams per deciliter is generally considered hypoglycemia. Remember, these are general clinical thresholds. Individual treatment targets can be different. When should you contact a doctor? So, what should you do if your results don't fall within the expected range? If you repeatedly have high fasting glucose readings, and increasing HbA1c, persistent symptoms of high blood sugar, or frequent episodes of low blood sugar, speak with your healthcare professional. You should also seek urgent medical care if you develop very high blood glucose together with severe symptoms such as vomiting, abdominal pain, deep or rapid breathing, confusion, severe weakness, or altered consciousness. These can be signs of a serious metabolic emergency. And never change or stop diabetes medication simply because of one blood glucose result. Medication adjustments should be made with appropriate clinical guidance. The doctor's way of reading your results. So, how do doctors actually approach a blood sugar result? They don't simply ask, "Is this number normal?" They ask several questions. Was the patient fasting? What time was the test taken? What has the glucose been doing over time? What is the HbA1c? Are there symptoms? What medications is the patient taking? Are there other medical conditions? And does the result fit the overall clinical picture? That's the difference between simply reading a number and actually interpreting it. The big takeaway, and here's the most important takeaway. Your blood sugar result is not just a number. It's a piece of information about what's happening inside your body. Fasting glucose tells you what your blood sugar looks like after fasting. Random glucose tells you what your glucose level is at a particular moment. And HbA1c gives you a broader picture of your average glucose exposure over the previous 2 to 3 months. The most important thing is not to fear a single abnormal number. Look for patterns. Understand the context. Confirm abnormal results when appropriate. And work with a healthcare professional to determine what your results mean for you. Because when you understand your numbers, you can have a much more informed conversation about your health. If this video helped you understand blood sugar testing, subscribe to PharmaconHealth. Here, we explain health, medicine, and drug information simply, using evidence instead of hype. This is PharmaconHealth, where better health starts with better information.